So you ask, is there a future for clinician scientists? This is like the elephant in the room. Speaking of that, thank you. The elephant in the room is, will there be a future for clinician scientists in Canada? And I'm thinking to myself, what kind of a question is this? That's got to be the dumbest question I've ever heard. I mean, I guess if you want a second-rate health system where nobody's ever going to discover anything new or innovate and just have the hospitals and ambulatory clinics filled with patients, I think that'd be terrific. We just won't know anything. We can be just a bunch of ignoramuses. But actually, the health system that I've got in mind understands new things every day, tries to figure out how to make the patient experience better, how to cure diseases, how to allow people to live with them. Who's going to do any of that unless you know how to ask questions, understand clinical problems, and can put clinical problems together with research questions and actually come out with answers that are scientifically cogent and then figure out how to adapt them into the health system. That's why we need clinician scientists. Now, some people say we can't have any of those people because they're too expensive. Now, that's true for physician scientists. We're actually pretty expensive. But the good news is that nurse scientists, psychology scientists, you guys are so poorly paid to start with, and it'll never get better, that it's not going to be that costly because your salaries aren't going to go up that much, and you're pretty cheap when it comes down to it. So I'm not worried about that. Then the next thing people worry about is that nobody wants to do that. Now, this is where human genetics is teaching us something. Because it turns out there's a small fraction of the population that have so many mutations in their DNA that they're going to behave abnormally compared to the rest of the people. That's a clinician scientist. That's a person who's a clinician who stands in front of the mirror every day and says, I need to learn something new. And I can't live my life if I'm not doing that. Now, luckily, there's going to be enough people like that with enough mutations. They're going to be able to resist all the decreases in funding, the poor pay, the lack of support in institutions, and they'll just keep doing it. So I don't think that's a problem either. You know, the other thing that comes to mind while I'm thinking of all the dumb reasons why people think that clinician scientists can't thrive is that people say that because of poor funding rates in the country, that clinician scientists will never survive. Well, in fact, given the current climate at CIHR, even with lower funding levels, clinician scientists are the very ones that can profit from the CIHR's focus on interdisciplinary team research, patient-oriented outcomes. They're the ones, we're the ones who are going to thrive in this kind of system because we're trying to have grants that are going to help the health system. But clinician scientists, because they live at that bridge between patient experience, progress, are the kind of people that are going to be invested in as the future's going forward. The other thing that comes to mind, I'm just thinking of all the stupid things that the other side must be saying about why clinician scientists aren't going to be funded. The other thing I'll bet you they're thinking is women can't have careers as clinician scientists. Now that's dead wrong too. The thing that's hard for women or people who want to raise families is that they are working clinically 8 hours a day or 12 hours a day. They don't have flexibility. When you're a clinician scientist and you're doing research, you got all the time you want, whenever you want to have it. That's the beauty. You have flexibility. It's terrific in terms of lifestyle. So that's another myth. That's another bunch of bunk. I bet you people on the other side must be thinking that, but it's wrong. You know, I'm remembering back when the CCHCSP was created. That was in 2001. People said to me, you know, you're never going to train any clinician scientists who aren't doctors. That is, physicians. I said to myself, that can't be right. They said, you know what? None of them are going to be interested in becoming clinician scientists. Now, 10 years later, the CCHCSP has trained over 70 people as clinician scientists. And guess what? 60% of them aren't physicians. Well, there's another stupid myth dragged through the dirt. Anyway, that's just a couple of reasons why there's a fantastic future for clinician scientists in Canada.